It's time for Work Comp Talk. Coming to you from the Pacific Workers Studio in Concord, California. It's Work Comp Talk. Interesting people talking about the issues that affect the lives of the everyday people that keep our communities moving. Sponsored by Pacific Workers Compensation Law Center, the lawyers for injured workers. With offices in Concord and Oakland, Pacific Workers is the leader in California workers' compensation, representing injured workers throughout Northern California. PacificWorkers.com, the lawyers for injured workers. Now to your hosts, Eric and Carmen.
Hi guys, and thank you for joining us here at Work Comp Talk. Eric has the day off. My name is Carmen Ramirez, co-host and producer of the show. We'd like to welcome you and thank you for joining us. And if you haven't followed us yet on your favorite podcast platform, make sure you do so. We are on iHeart, we are on Spotify, and yes, I am starting to see the numbers grow, so I'm getting super excited the fact that people are actually spreading the word. Pacific Workers, once again, is sponsoring our show today. They are Northern California's top workers' compensation attorneys. You can visit them at pacificworkers.com. You get injured at work. And if you have questions in regard to some of the stuff going around specifically with COVID, you can definitely call for a free consultation. You think you might have gotten COVID at work, they can take care of you. That's 1-800-606-6999. And joining me today is Amy Nee, who is a critical care doctor and also a pulmonologist. I'm super excited to have you on board. We're going to dive into some of the stuff you're seeing as a frontline worker, what you're seeing with COVID, and just I want to paint a picture more than anything of what really is happening to the lungs when they get attacked with the virus, coronavirus. So you graduated from Penn State University Medical School back in 2013. You completed your internal medicine residency at UC Irvine in 2016. You also did your fellowship, which from what you've explained to me previous in this conversation was when you kind of get your niche onto what you're doing, you stick to it. Therefore, you consider a pulmonary critical care fellowship from UCSF back in 2019. You've had the luxury of living on both sides of our nation, the East Coast and the West Coast. However, the Bay Area is a beautiful place to live, so therefore you stick to California. Not only to mention you did fall in love with someone who does live in the West Coast, and it just so happens to be our co-founder and managing attorney, Bilal Qasim. So thank God he fell in love with you, because otherwise I don't think we've had the opportunity to dive deep with someone who's actually in the front lines. So I'm excited to have you on. Thank you for joining us, Amy.
Thanks for having me.
So let's dive right into it. What is a critical care doctor? I feel like a lot of people might not understand what that means. I mean, I think of critical care and I think of, oh, I don't know, someone got their leg chopped off. It's critical. They need care. So that's what I think of a critical care. So maybe defining what a critical care doctor is, or a specialist and a pulmonologist.
Right. So yeah, I mean, if you have your leg chopped off, definitely that would be taken care of by a whole host of different doctors, one of which would be a critical care doctor, probably. So critical care doctors usually get trained in both pulmonary medicine and critical care medicine. It's sort of a combined fellowship and subspecialty of internal medicine, which is what we call a generalist, usually in adult medicine. There's definitely critical care doctors that also come from other fields like emergency medicine, anesthesia. Right. But with the pulmonary critical care component of it, what we are expert at is managing patients who not only have traumatic injuries, heart attacks, gastrointestinal bleeding, but also respiratory failure, or patients who have such a severe lung illness that they're unable to breathe on their own and have to be placed on a breathing machine or a ventilator, which just happens to be very, very important in the case of taking care of COVID patients nowadays.
Right. It's like the number one symptom. Some of the stuff that people are, coming back with is I can't breathe, shortness of breath, feeling like there's an elephant stepping on the chest. Why would people feel or associate those type of feelings? What exactly is the virus doing to the lungs to make someone feel that way?
Right. It's essentially, there could be sort of two processes going on. And initially it would be sort of like a pneumonia. And for people who've had pneumonia before, you have fevers, chills, shortness of breath, and cough. And that's really the virus itself attacking some of your lung cells and causing injury. What ends up happening in certain population of patients who get COVID and they become actually critically ill and develop respiratory or lung failure is that the body's own immune system starts this process being hyperactive. And that creates this circle, like the tsunami in the lungs where the immune system becomes hyperactive. The immune cells become very active and they develop a very severe inflammatory response to which the virus is no longer really a big part of the picture, but it's really the patient's body themselves causing it.
It's kind of like the virus came in, just disrupted everything inside, left some residue, and now your body's dealing with its own self.
Absolutely right, exactly. And so that's in some of the most, the sickest COVID patients that we see is what's happening.
Right. As a frontline worker, you're facing COVID on a daily basis. How was it for you when you got the first case of COVID-19? I'm pretty sure you had read up on it. I'm pretty sure you mentally tried to prepare yourself for it. But having that first patient finally come in and knowing I have to treat this person that I'm 100% sure has COVID, what was that like for you?
Very scary. Lots of fear. And I think I sort of resound with a lot of my colleagues, fellow nurses, fellow doctors, and all the practitioners around the world when they first had their first case. I would say probably California is a little bit lucky because we had the opportunity to see this tsunami wave happen first in other parts of the world, obviously China, Europe, and New York, before it kind of hit us. And when it did hit us, it was not as big of a tsunami, I think, at least in Northern California, as some of the other states. So we had time to sort of mentally prepare, but there was a lot of fear, a lot of anxiety, because at the time there's still a lot of unknowns about the virus. Although we started to hear algorithms and ways of managing the patients from other doctors who've had more experience. And we started implementing those right away. So the first patient that we saw actually were some of the sickest patients, and they were immediately placed on the ventilator. The first few times of gowning up in our protective equipment going into the room, your hands are definitely a little bit shaky. Wow. You try your best to kind of look at single thing you touch, and be extremely careful with protecting yourself and protecting other patients and other workers in the hospital. And also, coming home was a ordeal too, to have thought, okay, I'm gonna come home, what's the first thing I want to do is just to jump in the shower. I'm sure that kind of is similar to a lot of the workers out there in the public who unfortunately are unable to work at home. They have to go out there. So I think all of us had probably similar experiences with figuring out our own algorithm.
Something that was going to work for you. And I mean, I think in the beginning, we did see a lot of memes and TikTok videos being created of people getting hosed down right before they go into their house. I mean, though it might have been funny at the time, it was actually the reality of many people. Speaking about Frontlines, as yourself, I think in workers' comp, as the law firm, we've also realized 1 out of every 9 cases still till this day is COVID related. And just in August alone, I was reading a blog where they mentioned the numbers, the statistics coming in just for August dated claims for workers' comp here in California. You were looking at over 5,000 cases, and some of those cases leaded to death. So it's a very serious conversation. It's something that's still very vividly, though we are in the middle of campaigns and political fights, I do think the light was kind of taken off a little bit off of COVID. People got too tired of it. It's just COVID, 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 the holidays and COVID, like don't go to Memorial Day festivities, like all the rallies. There was just so much bombarding our world in so many ways, the rallies, the protests, like in so many aspects that I feel like the severity and the importance of COVID kind of dimmed down a bit. And people might have assumed, okay, well, COVID's disappearing. I'm not hearing it in the news as much. Therefore, do I really need to wear a mask? What would you say to a person that would essentially believe that's the case nowadays?
Yeah, so COVID is not going anywhere anytime soon. It's here to stay. As for how long it's going to be with us, I don't think anyone really has a clear idea. I think it'll depend on how a vaccine may or may not be effective once it gets out. And then also, biology sometimes just surprises us, right? As COVID clearly surprised all of us. So the way the virus may or may not change in the future, that's yet to be seen. And so, I would say to those people, please take it seriously. We're still seeing cases, and what I can tell from my hospital is that every time we see either a local, a state, or a national uptick, we extremely correlate that with the number of patients that we see in the hospital, on a smaller scale, obviously. So we have to be constantly vigilant because this virus is not going anywhere anytime soon. If we lose that constant vigilance, it's going to flare up again.
And it could happen at any moment. I'm actually hectic to talk about as a mother. I have three kids. Going back to school, it's something that's been back and forth. Yes, they're going back to school. No, they're not going back to school. I honestly didn't think the kids were going to go back to school till next year. And I recently got an email notification from the school stating that, guess what, October 14th, school is back in session. As a frontline worker, as a expert in seeing what's happening with COVID and what it's doing to our bodies. I don't know, like, what do you think about that idea, getting kids back to school? I mean, they're from different households. They go to different places. You're pretty much putting a whole group of kids from different areas in one. And it's kind of like, to me, it's just going to spread. That's what I'm thinking.
I think I probably agree with most public health experts that children who contract COVID have a much lesser illness and they can probably recover quite well, although there is a small percentage of children who get very severely ill or can get severely ill. I think the main problem with the school question is how that's going to affect the spread of the virus in the community, as you exactly mentioned, that kids are all from different households. And my major concern is, the kids can recover, but if they transmit that to a grandpa who's living in the same household, how is that going to look? Probably not too good. And so I think I'm not saying that opening up schools is a bad idea, because I think eventually we have to figure out a way of opening things again, but we just have to have a clear-cut plan, a clear-cut algorithm on either protective equipment, screening, physically socially distant learning in the classroom if possible, to not erase the risk, because I don't think we can erase the risk to 0% at this point, but to reduce it as little as possible so that we don't have these flare-up events that can kind of explode like an exponential bomb and spread in the community and cause, potentially hundreds of people, maybe if not thousands, to get infected.
I mean, it's easily spreaded. It's scary to know that some people don't take it serious. Others feel like, oh, I'll be fine, nothing's going to happen to me. But I think it's very important, as you stated earlier, that it's not just about you. It's about that grandparent that's living at home. You may be asymptomatic, you may be totally fine, but it's that other person. What are you seeing in some of the patients that come to your hospital with COVID? What are some of the complications that are just I guess, unexplainable to us. We're not experts. We only hear, oh, I can't breathe, but what does it mean when they say, I can't breathe, my lungs just don't feel okay? Can you kind of explain or paint a picture of that?
Yeah, the acute complications, when I see patients in the ICU, it has to do a lot with patients who are just critically ill in general, especially with respiratory problems like the severe category where they develop acute respiratory distress syndrome and have to be put on a breathing machine. The long-term effects that, they may take months, if not sometimes even potentially years, to kind of try to recover to baseline. And even then they may suffer permanent scarring or damage to, not only their lungs, but an ICU stay in general kind of debilitates the body in an extreme way, and it'll take many months to recover. For the most part, people who recover without being so critically ill may or may not experience long-term effects. And I think that part is kind of an interesting aspect where we're starting to see a little bit of that in our pulmonary clinic. There may be long-term fatigue. There may be shortness of breath that is really unexplained at this point. And there's other sort of novel complications of coronavirus that I think is just the part of the disease that we're still learning. There may be clotting problems that can develop. It can cause heart muscles to become very weak, and very rarely can cause disastrous neurological complications, such as strokes. So the presentation is really very wide, but the long-term complications might be, for the rest of someone's life.
Wow, that is insane. So, I mean, we already know it attacks people in different ways because everyone has a different immune system, different complications. Some people have asthma, other people just have other types of situations that I feel like, analytically speaking, if we would try to understand the virus a bit more and categorize this, if you were to say, these are the symptoms, it's not gonna be easy. It's kind of coming in case by case. Everyone is getting different type of symptoms because everyone's body is different. So do you feel like, as some of the patients keep coming in now, is it easier to treat? Is it less of a, I guess, effect on them? Or again, because bodies are different, everyone's immune system is different, is it still high risk for some? What are you seeing in the front lines?
Yeah, I think it seems like, because we've had two major research results that came out since this all started, one being remdesivir and the other being Decadron, or steroids in general for treatment, that has been shown to have some effect. We've kind of have a clearer way of the process of treating the patients. I think there's still obviously a lot of unknowns at this point. And I think it'll take a long time to kind of look backwards at all the patients we treated so far and analyze all their information and data through a rigorous research process to kind of figure out, were the things we're doing in March the correct way, or were the things we're doing now better for our patients? So I think we have more of a slightly more reassured process of treating the patients, but in terms of, does it actually help them? That's going to take a longer time to decide.
What do you feel is a possible scenario as to when you think someone's going to create a vaccine? Do you see that in the long run, short run? Where do you, as an expert, where do we fall on that?
Yeah, so I mean, I think the vaccine sort of question is, it sort of depends on, I don't think we'll know until a vaccine has been given to the general population, and having that run its course for some time. I don't think we'll have a definitive answer, because all these phase 1, 2, and 3 trials are meant, bigger and bigger number of people in the population, but really how truly effective it is can be only seen on a entire population level.
Right.
And so if you imagine, you might have a couple of candidates, but it'll take time to create the vaccine. It'll take time to distribute.
Yeah.
It'll take time to maybe convince everyone to actually take the vaccine.
Mm-hmm.
And just the biology of vaccine medicine itself, it's going to take some time to see its effect on the entire population.
That's so true. Eric's always mentioning to us how, this is not going to be an easy process. And even if they do find something, they have to then create, they have to then, make more of it, spread it, share it, and get everyone to actually get the shot. So we're in it for a long haul, and I really appreciate your time, Amy, and diving deep into what you're seeing in the front lines. I know that, statistically, some of the cases we're getting here in workers' compensation are from healthcare workers, people in the front lines as yourself. If there's anything you want to share with those that are in similar situations, maybe not necessarily in a hospital, but grocery store clerks, they're also in the front lines, they're also essential workers, that you would like to share with them and just give them some sort of advice?
Yeah, I think as with all frontline workers, we have to learn to live with the discomfort of knowing that there's no 0% risk in any situation that you're in, particularly if you're taking care of patients or with the public. But what you can do right now is just what we know to be the basics that seems to work is, wearing a mask at all times if possible, when you're out around with other people, socially distancing, and obviously good hand hygiene, washing your hands at least 20 seconds. Other than that, we have some therapies, but they're not miracle by any means. So being vigilant, being very careful, sort of reducing your exposure to other people as much as possible, and knowing the people that you interact with. If you have family members who are immunocompromised or elderly, trying to reduce their exposure as well, protecting the ones that need to be protected. And I think that's really all we can do, but not only to do that, but to consistently do that until we really have this thing down.
Yeah, and that's uncertain. We don't know if it's going to be 2021, but I think I completely agree with you on that. If it does happen, that it takes another year to tame it down, because I feel it's never going to go away. It's like it's already here. We just have to deal with it until we know exactly how to deal with it. The new norm is wearing your mask and, social distance from everyone, though a lot of people don't take it so serious. But I think that's the best way we can handle it. It's the new norm, and kind of just adjust to it. There's changes in life throughout all of everyone's life. This is just a change that happened to all of us at the exact same time. So just that as we adapt in our own personal life changes, this is just something we would have to adapt to sooner or later. And it's insane, but it's the reality of what's happening. So Amy, I read a blog, or I was actually watching a video, and they were explaining some of the things that happen to the lungs when you get the shortness of breath, when the virus attacks. And the guy vividly explained, kind of like having a kid's party balloon. The first few puffs it's pretty hard to get the air in it, but once you get the air in the lungs, they expand and you're able to breathe. So when the virus hits the lungs, if someone already had issues previous to coronavirus, just in their health in general, what is happening on inside the lungs? What is the coronavirus doing inside the lungs?
Right. So, if we extrapolate that to the most sickest patients who develop COVID, essentially what that might feel like to the lungs is you're drowning in your own inflammatory cells and your own body fluids is essentially what might be happening. And eventually,
would this be like a feeling, you know, like when you accidentally drink something and a drop of water goes in through your lungs and you feel like you just have this big old gulp and it just hurts? Like, would it be something of that sensation, feeling like water went through the wrong tube?
yeah, maybe more so as if you just, no matter how hard you try to take a deep breath, you're just not fully satisfied. And so your breathing rate goes up. You might be taking really rapid and shallow breaths because your lungs are filled with all these inflammatory fluid, and the amount of surface area in your lungs to be able to exchange oxygen and carbon dioxide efficiently becomes very diminished. And so you're trying to compensate that by breathing rapidly and shallowly because you've lost a lot of that surface area. So, you know, what it probably must have feel like is you're in a way kind of drowning in your own fluids. And that's not a good, that's a terrible feeling.
I can just imagine. Yeah, no, I mean, that's a great way to put it. Is there anything that you guys have been adapting to take care of the patients? Any new way that you guys have been attacking the virus?
Yeah, so I think other than the two major medications we're now giving, remdesivir and steroids, I think our approach to patients who have respiratory failure or lung failure has kind of changed throughout the last couple of months. Between early on, I think in March and April, we were placing a lot of people quickly on ventilators. And as we went along and looking at experiences from many other hospitals around the world, we've noticed that not doing that so early actually prevents a lot of patients from dependent on a breathing machine, which it's in it of itself causes a lot of long-term problems.
Wow.
So we've been able to not place as many patients on breathing machines, and a lot of them actually are able to recover. But it's something where we even have to change, our traditional way of taking care of patients with respiratory failure. It was something that we normally did not do. If you were to tell me that this patient walks in with this set of symptoms and vital signs, a year ago, I'd say 99% of all critical care doctors would say, put them on a breathing machine. And that has changed significantly since COVID. So that's a new area. I think, to really evaluate how effective that is and why that's effective, it's going to take many years of research.
That is crazy. I mean, we've learned so much. Thank you for your time, Amy. I feel like we can continue to have conversations about this. We're going to continue actually to have conversations like this. Things are going to continue to evolve, and all we have to do is just kind of ride out this wave, whether it's a year or less than a year. Our ultimate goal is to protect ourselves as best we can with following those guidelines. And I just think it's all going to go away sooner or later, or some vaccine miraculously is just going to get built and it's going to work and everyone's going to get it, and then everything's going to be kind of somewhat similar. But again, I can't stress enough how appreciative we are to have had our co-founder fall in love with you, and it just so happened that you were an expert in something that the whole world is facing, and that we actually get to take time from your day off to conversate and dive deeper into this. So I want to thank you, Amy, for joining us today.
Absolutely, pleasure and happy to. And I just want to stress to everyone again, be vigilant. We're in this together, and the only way to not totally erase the problem, but make it less painful for all of us is to be vigilant together.
That is correct. That is 100% correct. So if you have any other further questions, you can always call us. If you think you've gotten COVID at work, you can definitely reach out to Pacific Workers, the Lawyers for Injured Workers. It's truly been an honor and a pleasure to be with you in this episode. Eric's going to catch us back on the next episode. And if you haven't yet, make sure you follow us everywhere on social media. You can follow Pacific Workers. They're even on YouTube. I mean, by now, I'm not surprised we haven't created a TikTok yet, but who knows? We just might. We'll have Bilal doing some TikTok videos. I'm sure he'll like that. And definitely, yeah, also Work Comp Talk. Make sure you guys subscribe on your favorite podcast platform. We are seeing the numbers grow, so we do appreciate everyone who's spreading the word. And we hope you enjoy the rest of your day. We'll catch you guys on the next episode of Work Comp Talk. Thank you.